Live is our time right now. Did you know more than 60 million kids are involved in organized sports, which is great, right? They're getting active. But about 70% of them get out of the game by age 13 because of getting hurt or maybe burnout. There's a new report out from the American Academy of Pediatrics, and it looks at the growing epidemic of sports-related injuries as young athletes play and train more without properly resting. And, you know, overtraining can lead to overuse injuries because growing bones can be so vulnerable to stress injuries. That's why this morning we're talking about this with Dr. Shelden Martin. He's an orthopedic surgeon with a specialty in sports medicine at OrthoArizona. Thanks for being here, Dr. Martin.
Absolutely. Thanks for having me.
And you guys have seen, especially across the valley, just the growing number of kids getting hurt from sports, right?
Yeah, we see it all the time. Every day in our offices, we have these athletes coming in. You know, and as that report stresses, it really is an overuse problem just from, you know, a number of different factors, but mainly just not getting enough rest, overtraining, playing sometimes years without really taking a substantial amount of rest.
It feels like kids are training all year round for their sport too, especially here in Arizona, right?
Yeah, absolutely. And I have this conversation every day in the office, and it's really an epidemic, as that report from the American Academy of Pediatrics outlines. It's growing in the warm weather states, you know, so Texas, Florida, Arizona, California, where these athletes can be outside training year round. It's really a setup for this problem.
As we talked about this in the newsroom, we know that we have seen it across many of our producers, our writers, our kids. In fact, we've got some pictures. We thought we'd share some of these injuries. From April's son, this was Charlie when he broke his arm. One of our writers, Adriana, broke her growth plate in her right leg. I know we have that while she was playing. This is Sarah as well. This is Adriana, who broke her growth plate, as I was saying. And then we also had Sarah, our producer. She had injured herself as well during soccer. The list goes on and on. We see these injuries. We just had a recent injury in our family with my daughter getting hurt. My son's broken his ankle, so many different things. So what can we do as parents, right? That's the big question, because maybe you take them to urgent care because you want to avoid the ER. That's not always the best case.
That's right. And so, you know, education, I think, is really important here, because many of these overuse injuries that come in and see me in the office are not requiring surgery as treatment.
Okay.
It's just education regarding rest, that you need to take more time off, take some months off from whatever sport you're playing. And I see it across all sports. You know, some of the more common offenders are really baseball and soccer, where I see it the most.
Okay.
You know, these young athletes are coming in. They've been playing year-round for years, not taking rest. Their shoulder, their elbows hurts. The treatment is usually always just rest from throwing, cross-training, try doing another sport. So educating the parents, educating the athletes, educating the coaches, that along with the rest are really just the treatments. Sometimes we get them into physical therapy to help as well.
Okay. And of course, each individual case, we know, it varies. That's why you guys created InstantOrtho. I recently learned about you guys with a kid with we thought was a fractured arm. Went to you guys for a second opinion. It wasn't fractured. So you guys treat this as like an urgent care just for orthopedics, correct?
That's right.
What do you guys treat there?
Yeah, so we see all musculoskeletal conditions from, you know, the head down to the toe, really. So spine, shoulder, elbow, hand, wrist, hip, knee, foot, and ankle problems. We see it all. We see athletic injuries, and we realized we've been in focus now for about a year and a half, really getting this going. Developing the proof of concept, we realized that there was really a need out there in the community.
Yeah.
Because to get into some of our providers, it may take weeks or months as a new patient. And as you said, the emergency room really isn't a great option. Long wait times, it's very expensive. They're really not focused on musculoskeletal care there per se. So we knew there was a need in the community to develop this model. And so we've been doing this, as I said, a year and a half. It's been wildly successful. As you mentioned,
yeah.
Everyone kind of has their own experience with, you know, coming to us. And so we've got skilled musculoskeletal providers who are evaluating these patients, and then they're getting plugged in immediately to our surgeons. And
Which
so
is
if they
fantastic.
have something urgent that needs to be, you know, dealt with surgically, we're going to get to that in the next day or two. And whereas it's more of a minor ache and sprain, you know, by the time you get in to see one of our surgeons, it's probably getting better anyway.
That's fantastic. And they have 2 locations in Scottsdale as well as in Gilbert. We'll put all the info on azfamily.com. Thanks for what you guys do, and hopefully now, you know, with just more education, as you said, parents will understand. And it's hard having the kids understand, though, right?
It is, and because they love doing it,
Yeah.
and you can tell the emotional impact when you say, look, you need to rest and stop playing baseball or whatever sport it is. The next question inevitably is always, well, how long?
Yeah.
And my answer is simple. It's, well, it's as long as it takes.
Yeah. All right. Harder said than done, but you got to listen to the doctor and listen to your parents. Thank you so much.